So this splint is used for diagnoses like deep wear veins, osteoarthritis, and rheumatoid arthritis of the wrist and the thumb. We also use it for scaphoid fractures, so we use it for a lot of different diagnoses. So this splint, it goes over the wrist. It's a long thumb like as opposed to the short thumb. It immobilizes the wrist, carpal metacarpal joint, as well as the metacarpal phalangeal joint. Keeps the fingers free, as well as the IP joint of the thumb. Okay, so once we've traced our pattern, we want to mark certain landmarks around the hand. So the first one is around the distal wrist crease, just on both sides. We also want to mark the MCP joint of the thumb, the IP joint on both sides, the distal palmar crease on the radial and ulna side, as well as the middle of the PIP joint of the index finger. Alright, so I want to talk a little bit about the splint pattern that we're going to be using. So when we're drawing the forearm trough, we'll start down here, drawing the forearm trough. This area underneath the wrist is 2/3 of the patient's forearm length. Measure their forearm. If it's 9 inches, the forearm trough to be 6 inches long, because that's 2/3. When we're drawing the forearm trough, put the pencil at about a 15 to 30 degree angle to the forearm. Gauge between 15 and 30 degrees based on the width of the patient's forearm. Some patients have larger forearms than others. Tapering it in towards the wrist. Once you get about to the wrist, start bringing it out at about a centimeter away from the outer border of the thumb until you get to the MCP joint, and then start going straight up towards the thumb. That's important because this portion is going to be part of the thumb tab, also known as the C-bar, that's going to wrap around the thumb. So it's important to get that. This length is going to be the same as that length. So it's important to have that straight, right from the MCP joint. Go straight across the IP joint, and then kind of have a smooth angle going up to the PIP joint of the second digit or the index finger. This is about a centimeter away from the index finger. From here, it's also about a centimeter away from the ulna aspect of the hand, and then same thing, bring it down to the wrist and kind of go out depending on the width of the patient's forearm. So now we have the cutout of the splint right here, and we're going to try it on the patient just as kind of a trial run to see if there's anything obviously that we need to change to it when we put it on the thermoplastic. So here I'm just mainly looking for this tab to make sure it goes around her thumb correctly. Bring it around. Okay, so I'll turn her thumb around so you can kind of see that. You're looking for this part of the tab lines up well on this side of the thumb. So you bring it around, and you want to see that there's a clear continuous seam right here, and then down here this is also a continuous seam. You're also just making sure that when those are connected, that the distal palmar crease isn't being impinged or isn't being covered by the this aspect of the splint. And then you want to kind of check the forearm portion, see that that's gonna fit okay and it's the correct length, and looks all right. It doesn't have to be perfect at this point. We're just making sure that there's nothing really obvious that we want to change at this point. So now I'm gonna trace this pattern onto a piece of thermoplastic, and we'll cut that out. I got my grease pen, and I'm gonna just trace out the outline of my splint. So again, you as much as you can, you just want to try to get around any of those holes as much as possible, just because when you fit it to the patient, they can cause, you know, skin irritation. You can. All right, so got that all traced out, and we'll just dip it in the heating pan or in the splint pan and get it cut out. Okay, so now we're ready to cut out our pattern. I have my splint pan here, got a couple scissors ready to cut it out, and you also want a flat surface to place it on while you're cutting it out so it doesn't warp while you're cutting out the pattern. So I'm going to put it in here. So this splint pan is automatically set to heat up at 170 degrees. Some splint pans you have to be constantly checking to make sure the temperature is right. So you'll have a thermometer there checking to make sure it's staying around 170. And with Polyform, I usually don't wait that long because it's so pliable. So this is about good before I actually cut out the splint pattern. Right, so now we're gonna get the patient ready to put the actual splint on. So we're going to put the tubular gauze over the thumb. I cut off just a small section of it that's gonna go around the MCP joint. And we also have the stockinette. I made a small hole on the side that the thumb's gonna go through. When you're putting on the stockinette, I mean, the patient is almost always going to be in pain, so you want to do it really delicately. So you kind of stretch it out like this, and then just real delicately bring it over the fingers, let them know where to put their thumb through the hole. So really delicately kind of pull it out so you have extra space so it's not pressing on any of those joints. And then once that's on, we want to make sure that the seams are all flattened out on the front and the back and in the web space. So we kind of pull up here past the index finger. So if they can hold a pencil, this is the position you want them to be in. So I give them that tactile cue to keep their thumb right here, and then I take the pen away and ask them to raise their fingers without moving their thumb at all, and that's the position you want them to be in. This is, you know, functional so that they can bring their fingers down to meet their thumb, and without having to move, you know, their MCP or their CMC joints at all. All they're going to be able to move is their IP joint and their fingers. The wrist is going to be completely immobilized. With any splint that goes across the wrist, it's especially important that the wrist is in neutral position, so the radial aspect of their wrist is facing them, facing their shoulder, and the ulna aspect is facing opposite of that. So she's in a good position, so we're ready to heat the splint up. Now we're checking the splint. You can see it has a good amount of drape in it, and we're just going to transfer it onto this towel, this flat towel. And this is for two different purposes. It keeps it flat when you're transferring it over to the patient, and also dries it off a little bit. So, you know, if the patient is sensitive to heat, it dries off some of the water, so it's not quite so hot on their skin. And you just pick it up like that and carry it over to the patient. Last check to make sure that thumb is in a functional position. You hold this one more time. All right, there we go. Then bring up your fingers. Perfect. Try to keep it there as best you can. Wrist is in neutral. Get those creases out. Alright, now we're going to put the splint on. First thing we want to do is bring this part behind the IP joint and make sure that that is this part of the splint, just like it goes around the thumb, the crease is right underneath that IP joint, and that's kind of your first landmark to start to fit it around the rest of the hand. So when that's in the correct position, you can keep moving down the hand, and next is to make sure that this portion of the splint is underneath the distal palmar crease, and kind of want to work down, make sure the wrist is either neutral or a little bit extended. Usually when you put a splint in their hand, they kind of want to flex their wrist down, so you want to keep that back. Right, and while you're doing this, you really want to be not using your finger to press in to have the splint conform to the hand. You want to be kind of stroking downwards. That'll keep it from getting any spots that can turn into pressure sores. If you have a patient that has a hard time keeping their fingers or thumb or wrist in the correct position, you can wrap the forearm. Just take that out of the picture so you don't have to be constantly going down here to make sure that's in the correct position. Just wrapping it around the forearm, and then you can focus on helping them get into the correct position with the fingers and the wrist. Okay, so now we're going to bring this tab back. I'm going to bring her wrist over. On an actual patient, you wouldn't bring their wrist into pronation, but I'm just showing so you can see how I'm doing this back here. You want to pull this tab around as best you can, and then you want to make sure that this point, the top, is lined up with the top of the seam around the thumb, and this bottom portion as well is lined up with the seam back here. So you want one continuous line, one continuous seam on the dorsal aspect, and then one continuous seam just right under the IP joint. And then we're gonna fuse those together a little bit later on. All right, we're good to go. So now I'm just gonna take it off and do some last adjustments. So now we're just kind of doing the last final touches to the splint. I'm gonna push down. I'm gonna spot heat this seam and just lock it in here, so it's gonna be completely continuous. The tab is gonna be continuous with the rest of the splint. So the next thing we're gonna do is I'm just gonna fold over all along these edges to make sure that there aren't any points that are jagged at all that are going to cause pressure points. Alright, so now we're going to get the straps on the splint. Try this on the patient. I also brought down the portion around the thumb, around the radial, and the ulna bony prominences. That's something you can do just to make sure that there aren't any pressure spots there. To fit the straps on here, you want to have an extra strap, and what we're going to do is just wrap it around the splint at the angle that on the dorsal side that the splint is or the strap is just flush to the skin. So when you bring it around, so I check on the back here, make sure that it's flush on the skin, and then I make a mark on you know, kind of more distal to the strap, and then right proximal to it on both sides. And that's going to be where you want to put the Velcro on the actual splint. So I did it there at the wrist. So there's going to be 3 straps. I did the wrist one first. Next, I'm going to do the most distal strap. So I start it right here, actually. Right at the ulna side. I put a little mark there. And I'm going to fold it in half because this strap is a little bit smaller. It's half the width. Then I make sure that it's right flush on the dorsal aspect of the hand. And then I bring it around, and on this side, it's kind of coming up diagonally. So you can see that it's not straight that way. It's a little bit diagonal up. So that's where it's real important to you know, make a mark of what direction you're going to be putting the Velcro on, because otherwise, if it's facing that way, it's not going to fit correctly, and it's going to be a little bit less secure. So you want the least amount of Velcro possible on the splint, just because if you have extra on, it can get snagged on their clothes and be a little bit less comfortable, and it could make them not want to wear their splint at all. Okay, so now we're just cutting out the Velcro for our splint. So when you cut it out, you want to make sure to round the edges. That will keep the Velcro, when you take it off, from pulling an edge off of the splint. So you want to have it rounded all the way around. Alright. So I already got the rest of them started here. And we have our lines all set to indicate which orientation we're going to put the Velcro in. So I'm going to peel this plastic off, and then I use scissors to heat up the Velcro in the heat gun. And it doesn't take very long. Just want to wave it over there for a second. And then you want to do the same thing on the actual splint itself. Alright, and then you want to place it just in the orientation indicated by the lines. So there we go. So it's kind of that way on the splint. We'll do this side too. Just so you can kind of see that I want to put it in this orientation, in line with where I put the marks on the splint. On an actual splint that I would be giving to a patient, I wouldn't make the lines as prominent because they're going to be wearing this around. So, and you want this to be like as aesthetically pleasing as possible. Alright, so we cut out the straps. Same thing with the straps, you want to round the edges. So at this point, we just check to make sure there's no, final little issues that we need to fix. So we check on both of the sides if there's any points that are pressing into the skin. We have the patient move her fingers up and down, and we could even have her do like some kind of a functional activity to see how it feels. Right here on the thumb, on the IP joint, you want to make sure that the IP joint is completely free with this splint, because it is a very restrictive splint. You're only able to move your fingers and your thumb, and your wrist, and these two joints are completely immobilized. So you really want to make sure that you lower this part of the thumb past well below the IP joint, so you really have full motion of that thumb. Also, right on the ulna aspect of the splint, where the distal palmar crease is, you want to make sure that that's well below that crease to allow for full finger flexion. A lot of times people, especially on the ulna side, will have some kind of impingement and impinge their ability to bring their fingers into a full fist. So you want to watch for that. The last one is just on the bottom of the forearm trough. You want to make sure to flare these edges out, because otherwise, when the patient brings, if they, kind of bend their forearm down, this part can pinch on their forearm. So you just want to avoid that too. The next step is to make sure the patient is educated on the precautions and wearing schedule of the splint. It's also a good idea, if it works in the patient and your schedule, for them to stick around for about 20 minutes to make sure there's nothing you need to change to the splint. Fitting a splint and having them wear it is a lot like trying on a pair of shoes at a shoe store. It feels great at first for the patient, and they almost always say it feels really good. And then as soon as they get home, they try it for a while and something happens. Things that they want to watch for are a red or a brown spot that comes up. It could be from a pressure sore. Also, if any numbness or tingling develops, as well as any edema or swelling in their fingers. Also, any discoloration. With some splints, for certain diagnoses, you can have the patient remove the splint and just wait until the next appointment, the splint check, which we usually schedule a couple days out anyway. You can have them remove it, and then you can adjust whatever during their next appointment. For some diagnoses, they have to keep their splint on, even if those things do develop. And in that case, you want them just to come in as soon as possible so you can get that addressed. So cleaning the splint, you want to make sure that they wash the splint with cool water and a little bit of soap. Also let your patient know that they want to avoid putting their splint in the hot car, leaving their splint in the hot car, because it will just turn into a puddle on their dashboard if they leave it in there on a hot summer day. All right, so that is it. Please let me know if there's anything I should add or if anything's unclear in this video so I can change it up. I kind of made this one a little bit more detailed just for students or beginners to splinting. But yeah, hope you enjoyed, and I will see you in future videos.